Migraine and Headache Awareness Month, and it comes at an important time. Neurologists at St. Luke's tell us they're seeing patients with worsening or more frequent migraines during the pandemic. I spoke with Dr. Sarah Gibbons about what can trigger a migraine and when to get help. So let's talk about this. More than 38 million people in the U.S. are living with migraines. That number is staggering. Why are many people dealing with worsening migraines in this pandemic?
Well, I think being in a pandemic itself is going to bring on a lot of stress, anxiety, fear of the unknown, and we do know that all of those things are triggers for migraine. Also, a lot of patients and people have had their schedules change, not following the same schedule that they previously had with school or work, and having that lack of structure can certainly trigger migraines as well.
So this might seem like a silly question, but how do we know when it's a migraine, and how do we know when is the time to talk with a doctor?
We really want to express that migraine is not just a headache. It's not just head pain. So it's multiple symptoms that come together to really potentially debilitate a patient. So you're looking for moderate to severe head pain. With a migraine, people are generally going to have worsening of their headache if they try to be physically active, do things like walk up a flight of stairs. Typically that is going to worsen the head pain. Sometimes they have nausea, sensitivity to light and sound. So it's multiple different neurological symptoms that come together to cause this.
And what are some of the latest advances and treatments for migraines?
So prior to about 2 years ago, we really had to treat patients with medications that were already on the market for other disease processes, like seizure medications, blood pressure medications, sometimes antidepressants. And it has been really exciting these past 2 years for both physicians that treat migraine and for patients who have migraine to know that there have been multiple therapies developed specifically for the disease process of migraine.
And are there also any lifestyle practices that people can use to maybe limit the amount of migraines or also really restrict some of those symptoms?
Right. Inconsistencies in the schedule can really trigger migraine. So even if you're not working the same hours, even if you're not in school anymore, it's important to stick to a regular bedtime and a regular waking up time each day, even on the weekends. It's important to eat regularly. We know that missing meals can certainly trigger migraines. It's important to also get exercise. I think that some of that has been lacking during the pandemic. So doing cardiovascular exercise, something to get your heart rate up, about 30 minutes, 3 or 4 days a week is a good place to start.
Okay, and if we're doing all of that and we're still seeing migraines, when would be a good time to see a doctor?
I think that anytime your migraines are affecting your quality of life, whether that be, you're missing more social events, you're having less productivity at work, you're not being able to be the family member that you want to be, that's the time to come see somebody.
Great tips there. So for more information or to make an appointment, visit stlukeskc.org. Gina?
Yeah, migraines can be so debilitating. Some good information.